it wasn't even a time issue this time. Rheumatoid arthritis. Do you know your family's medical history? I mean, mom, dad, grandmas, grandpas, brothers, sisters, aunts, and uncles. Do you know everything? Do you know all the things that they have? I had no idea of all my family's medical history. I knew my mom and dad, my grandma and grandpas, but I had no idea about my aunt and uncles. I knew that my aunts and uncles had diabetes and a few other small things, but nothing like this. Rheumatoid arthritis. My aunt, come to find out, does have it. It is debilitating to her. She is currently in a wheelchair and living in a nursing home. In November of 2018, I was having horrific pain in my hands, my feet, and my elbows. I could hardly get off the couch, and working was becoming very difficult. My fingers and hands were so swollen, red, and hot. I had gained a ton of weight because I wasn't able to work out or do anything I wanted to anymore. I became depressed and couldn't figure out what was going on. I had dealt with this pain for months. I finally decided enough was enough, and I decided it was time to go in. The doctor ran a bunch of tests, blood work, x-rays, multiple other things. Come to find out, it was rheumatoid arthritis. You don't need to live with chronic pain or horrible joint pain, swelling, red or hot joints. There are many options to be able to help you with these symptoms. You should be able to work out and do the things you want whenever you want and not have to worry about it. Today I will tell you about RA, what it is, how it is diagnosed, and the treatment options that are available. What is RA? According to MayoClinic.com, rheumatoid arthritis is a chronic inflammatory disorder that can affect more than just your joints. In some cases, rheumatoid arthritis affects your eyes, your lungs, your blood vessels, and your heart. Rheumatoid arthritis is an autoimmune issue. It happens when your immune system attacks your tissues. Osteoarthritis and rheumatoid arthritis are different because rheumatoid arthritis affects the lining of your joints, and osteoarthritis affects the actual joint itself. Rheumatoid can cause bone erosion and joint disfiguration. The longer you have lasting inflammation, the more your joints are prone to wear down. Now you have to be wondering, how do you find out if you have rheumatoid arthritis? How it is found and the treatment options that are available. There are many ways to find out if you have rheumatoid arthritis. You can have blood tests, having x-rays done, or even ultrasounds done. There is not just one test that can diagnose it. There are multiple different blood tests that can be done. You can check for anemia, have a rheumatoid factor done, a ACCP, or even a SED rate. They test for multiple different things, like inflammation, blood counts, and all the other effects from RA. Is there treatment for RA? Yes, there are many different treatments for RA. You can try multiple different medications. There are non-steroidal anti-inflammatory drugs like Advil, Aleve, and Motrin. There are stronger non-steroidal anti-inflammatory drugs by prescription, which can have more side effects. There are also steroids that can help you reduce the inflammation for short term. Then you will normally be tapered off of them. There are also medications that go after your immune system that triggers your joint damage, like Humira. You have a higher chance of infection on these drugs. Know that just because one type of treatment doesn't work for you, doesn't mean that there isn't a treatment option for you. Today, we have talked about rheumatoid arthritis. We learned what it was, how it was diagnosed, and the different treatment options. Rheumatoid arthritis is treatable. It is not curable, but with the correct treatment, you can live years without having debilitating conditions. Thank you for listening to something that I am so incredibly passionate about.